Okay, so when we decided to implement the Saving Together model in Perth and Kinross, we had a decision to make about whether to train a trainer to undertake training locally or whether to go for the core modules delivered to us. And because we're a small authority and we don't have a training department as such, we made the decision to have a series of the core training delivered to us virtually at that point. So we've had three series of the core modules delivered to our social work staff, and we have had three overviews that have delivered the overview version of the training to partners across our agency around Perth and Kinross. So we have now trained roughly 120 staff in the full model of Safe and Together. So that's including all of our team leaders, senior practitioners, and decision makers within Perth and Kinross to make sure that we could influence plans for looked after children, child protection plans, and to make sure that everybody was working to the same Safe and Together principles. We've also trained social workers from justice services and from our integrated drug and alcohol recovery team to widen that out. In the last cohort of training, because we were having some difficulties with recruitment and with illness within our staff group, we weren't able to use all the places for social workers, but that turned out to be quite good because we were able to include 2 health visitors and a school health nurse and our GERFET coordinator for education in the core module. And actually what that did was broaden the depth of knowledge within those services. The overview training has been really positive. So we've run that 3 times. We have had all the senior managers really across many of our services involved in that. We've had elected members that have come to that training that's been really helpful. And housing officers, community safety officers, people that are at really the front line of, seeing domestic abuse interactions. And it's really good for them to know, how they should interact and how they should behave. I think one of the big impacts have been that our culture has changed in terms of how we respond to um, domestic abuse. I think that we're much more acknowledging of protective actions that victim survivors are taking. I think we are getting better at holding perpetrators to account for their behaviour. And I see a sort of difference when I've been speaking to review officers and the coordinator for child protection planning meetings that there's better context being provided now in reports to understand victim survivors' actions and how protective they are. So I think that makes a real difference to how we're working with people. A significant impact that we've seen is that our child protection register numbers have decreased quite significantly. So about 4 years ago, we were usually sitting somewhere between 70 and 80. At the minute, we've got a low of 47, which is very low. And also usually we sit between 50 and 60. Now, I can't attribute all of that to Safe and Together because I think we've undertaken a range of actions at the same time. We've been getting better at providing early help and a range of family-focused interventions, evenings and weekends. So there has been a whole sort of cohort of measures that have introduced, but what we are seeing is that our child protection register have come down and that we are working really in less crisis-driven ways. I think sometimes in domestic abuse and able to take a more planned approach to that. So I think that's been really powerful. And I think that, some of the softer impacts, if you like, are that we have seen people that have attended the training, professionals that are able to come back and, speak about some of their experiences of being a victim or a survivor of domestic abuse. So whether that's been as a child and what they witnessed, or whether that's been in their adult relationships, we've been able to have some dialogues about that. And I think what that does is help everybody to understand that, we're not talking about an us and them, but we're talking about victim survivors. We are them, they are us. And I think it's been really helpful to really think about what that means in terms of professional relationships and how we support our staff. So I think that's been a really good softer outcome. I think the discussions and culture change have been really positive since we've introduced Safe and Together. Yeah, so I think one of the big enablers, weirdly enough, was the pandemic, because we were able to have some funding left in our training budget to begin this journey. That probably would have been really hard for us otherwise. So, that was a strange silver lining that came out of 2020. And then obviously being able to apply for the delivering equally safe funding was massive. We wouldn't actually been able to implement in the way that we have done without that financial support. I think from the beginning, what's been really helpful is that our Child Protection Committee have really backed us introducing Safe and Together, with financially in the beginning, but also in terms of making sure that, the reasons we were implementing Safe and Together were known to our partnership colleagues. We have had really good buy-in from senior managers, from at that point, people that were executive directors coming to the overview training and really making sure that everybody was getting a message that we were taking this seriously as an organisation, and we wanted to improve our response to domestic abuse right across the partnership. So I think that was really helpful. The other thing that I think has been enabling is that there's been a real appetite amongst our staff group to do this work. I think people have been really pressured over the sort of pandemic. There's been lots of long hours. There's been a rise in referrals, but people have put in the time to do the training, and they have pretty much universally come back and said how helpful they found it and how they would take that forward. So I think the sort of willingness and commitment of the staff to do that is really good. I think barriers have been during the last sort of several years, and same I think across Scotland, we have had recruitment issues, and what we've had is some turnover of staff, as I think many organisations have had. But I think what we're now seeing is, because as the model's been rolled out, is that sometimes now when we are recruiting people, they're already trained in Safe and Together, so it's not just like the Safe and Together trained people leaving. We're also getting some in that have been trained in other authorities. So that's been difficult. I think also in terms of when staff are impacted, well, when teams are impacted by staffing difficulties, it's hard to get released for training, because obviously the primary work with child protection has to come first. So that's been difficult over the last several years, and I think probably with hindsight, I have sort of taken the lead on Safe and Together, but my role is quite operational, in terms of managing fieldwork teams and stuff. And I think probably it would be better to have a designated lead. I think that's probably a lesson that we would learn if we were doing a future bid. But I think overall it's been a really positive journey with implementing Safe and Together. It is well received. It's I think having positive results. I think we're still very much a work in practice. We've got things that we need to continue to do and improve on. But I'm really hopeful for how it looks for the future for Perth and Kinross in terms of Safe and Together. I think one of the unexpected benefits we had from Safe and Together was the opportunity to work with partner colleagues in different ways. So I think one of the sort of good parts that have come out of providing the overview training, for example, is that all of our Perthshire Women's Aid colleagues attended the overview training. The majority of our independent advocates in Perth and Kinross attended the training, and actually, arranging that, setting that up, having discussions about it, allowed us to think about other things we could do in terms of training together, other things we could do to raise awareness. So probably from that initial piece of work, we've had some side shoots of work and some synergies that have been created that actually wouldn't have happened without that. So I think for me that's been an unexpected bonus of implementing Safe and Together. So I think that's probably the main thing for me.